The pharmaceutical industry, maintaining a sterile environment is absolutely crucial. Disinfectants play a vital role in keeping production areas free from harmful microorganisms, ensuring both product safety and regulatory compliance. However, many companies still rely on manufacturer claims or outdated practices when selecting disinfectants, which can lead to gaps in contamination control. Complexity of traditional disinfectant testing methods often makes it difficult for facilities to evaluate products effectively. This is where practical, real-world testing approaches become essential. Today we'll explore a comparative study that puts three common disinfectants, cetramide, Dettol, and Lizol, to the test on epoxy-coated pharmaceutical surfaces, using a straightforward surface challenge method that closely mimics actual plant condition. Accurately assess disinfectant performance, the study used a simple yet effective surface challenge method. Researchers prepared 10x10 cm test areas on epoxy-coated floors, which are commonly found in pharmaceutical plants. Each area was inoculated with one of 6 different microbial species, including E. coli, Salmonella typhi, Pseudomonas aeruginosa, Bacillus subtilis, Candida albicans, and an environmental Bacillus isolate. After air drying, the surfaces were treated with 1% cetramide, 2.5% Dettol, or 2% Lizol. The disinfectants were spread evenly, and contact times of 10 and 20 minutes were tested. Swabs were collected, and microbial counts were determined using standard agar plate methods. This approach ensured that the results reflected real-world conditions, providing meaningful insights into each disinfectant's true efficacy. Results were clear and compelling. All three disinfectants showed strong antimicrobial activity, achieving at least a 5-log reduction in microbial counts after just 10 minutes. However, 1% cetramide stood out by delivering a full 6-log reduction against all tested organisms after 20 minutes, and nearly all after 10 minutes, except for E. coli, which required the longer contact time. Dettol and Lizol also performed well, but each had specific organisms that were more resistant at the shorter exposure. These findings highlight the importance of both disinfectant selection and proper contact time in achieving optimal contamination control. Ultimately, 1% cetramide proved to be the most effective overall, making it a strong candidate for pharmaceutical sanitization programs. Study underscores the critical need for evidence-based disinfectant selection and validation in pharmaceutical environments. While manufacturer claims can be a starting point, real-world testing, like the surface challenge method, provides the practical data needed to make informed choices. The research demonstrates that all three disinfectants, when used at the right concentration and contact time, can significantly reduce microbial contamination. However, 1% cetramide consistently outperformed the others, especially at the 20-minute mark. For pharmaceutical companies, this means that both the type of disinfectant and the application protocol must be carefully considered to ensure effective contamination control and product safety.